I'm Dr. Fackrell. Welcome to Health Corner tonight. Tonight we're going to talk about diabetes, and specifically type 2 diabetes. Diabetes is a very common thing. In fact, as we as a society become bigger, diabetes has become more common. And it's one of the killers. It's one of the things that complications of it has been a very major reason for death in our society, especially here in the U.S. There are things that we need to watch for, and there are things that early signs that we need to be looking for. And if we do have these early signs, we need to be checked to catch it early. The earlier we catch it and fix it, the less damage to our organs it'll do. Unfortunately, if it's not, it can lead to blindness, it can lead to kidney failure, it can lead to amputation of limbs. There's just many things, and heart attacks and strokes, many things that diabetes can lead to. However, if it's corrected and it's treated, people can lead pretty normal lives. I have a lot of patients that I talk to and say, hey, this is a wake-up call. You've got diabetes. And a lot of times they will have some weight loss and they will start eating right and exercising, and it will do a lot better, to where some of them don't even need medications. So I'm going to turn the time to Jessie, the PA student who's worked with me in the past, and she's going to talk about diabetes mellitus type 2. Thank you.
Hello, my name is Jessie. I'm a PA student, as Dr. Fackrell mentioned, and I'm here today to talk to you more about type 2 diabetes. Now, type 2 diabetes, and just diabetes in general, is a really broad topic, and there's so much we could talk about. But today I want to talk about 4 things. First, I want to talk about kind of the differences in what it is and what the symptoms are. Second, I want to talk about the risk factors for developing type 2 diabetes specifically. Third, I want to talk about complications that can come up from diabetes and things you need to be aware of, that it really is a very serious disease and it's important to keep it under control. And fourth, I want to talk about how we can prevent type 2 diabetes and also how we can better control our type 2 diabetes if you have it. First, let's differentiate the different types of diabetes. There's type 1 diabetes. This is an autoimmune process, most commonly anyway. And I'll talk a little bit more about the other kind in a second, but type 1 is an autoimmune process where the body actually kills the cells in the pancreas that make insulin. So eventually, there's no insulin in the body. So these patients usually present with a little bit different history. They have unintentional weight loss. They may come in with diabetic ketoacidosis, which is a condition that I won't go into the details of, but basically they have really high blood sugar when they come in, and signs and symptoms from that and complications from that. These are the people that need insulin shots. These are also the people that maybe will have an insulin pump. It's most commonly seen in younger individuals, and a common name used to be juvenile diabetes, so that's something to remember. Type 2 is a little different. Type 2 diabetes, the pancreas is functioning normally, but for whatever reason there's either not enough insulin to go around because you become obese and there's too many tissues to supply, or your blood sugar has been high for so long that your body has continually made insulin, and now your cells, for whatever reason, have become resistant to that insulin. So the insulin receptor, how it physiologically works, the insulin receptors here, blood you eat, and sugar gets in your blood and it increases your blood sugar. This causes your body, your pancreas, to make insulin, and the insulin comes and binds to a receptor on the cell, and it opens the gates for the cell to allow your sugar to come into the cell and store it, thus reducing the sugar in the blood, because it's not good for your body to have increasing blood sugars in your blood. With type 2 diabetes, your insulin comes, binds on the receptor, but nothing happens. The door of the cell ignores the insulin, so therefore no sugar can get back into the cell and get out of the blood. And that's where we get the type 2 diabetes and the symptoms from type 2 diabetes. Now, eventually, just for your information, Uncontrolled type 2 diabetes can progress to type 1, meaning you wear your pancreas out. Those cells are not responding to the insulin, so your pancreas increases the amount of insulin it makes, and eventually the pancreas gets worn out and it's like, I'm done. I've lived a life and I cannot produce any more insulin. And these are the patients that will eventually also need insulin shots. So remember, today we're talking about type 2 diabetes. So I would like to talk about the signs and symptoms of type 2 diabetes. It's important to know that you may have type 2 diabetes and not have any signs or symptoms, but I'm going to list the most common signs and symptoms that happen with people that have this disease. All of the symptoms from type 2 diabetes come from high blood sugar, so just keep that in mind. The first symptom that I'll mention is an increased thirst. So patients may feel, you may feel, that you can't get enough liquid in your body, you can't get enough water, you just are thirsty all of the time. This could be a sign of type 2 diabetes. Along with an increased thirst, you may have an increased urination. You may feel like you have to get up 4 or 5 times a night and go to the bathroom. Or during the day, you're like, whoa, and I know I'm drinking, but man, I'm really having to use the restroom a lot. You may have blurred vision. You may have increased infections, specifically yeast infections. You may notice that your wounds are not healing like they normally did. So let's say you have a cut on your lower leg and it just isn't healing like normal. Another specific sign of diabetes is called acanthosis nigricans. And I know that's a really big mouthful of a word, but it just means that there's a crease in the creases on the back of your neck. You get some signs in the skin. I'll show a picture here so you know what I'm talking about. The appearance of the skin actually appears dirty or velvety in nature and is a little darker than normal. This is a sign of type 2 diabetes. So what can cause you to develop diabetes? Well, there's a whole list. I'll go through them with you. First is a sedentary lifestyle, and that just means that you're not physically active. This can predispose you to type 2 diabetes. A diet that is high in refined carbohydrates and sugar. That just means you eat a lot of white bread, a lot of cinnamon rolls maybe, or just starchy foods. A lot of potatoes, mashed potatoes, can even be high in carbohydrates, which your body then converts to sugar. So just be conscious of this. Be conscious of your diet and what you're eating. If you're obese, this could be a risk factor. You could go on and develop type 2 diabetes. If you have the genes, so in other words, your family history, your mom, your dad, your grandparents, you're going to be at an increased risk of developing this. With obesity, I need to mention specifically what we call central obesity. This just means that you have a larger waist circumference. In other words, you've noticed you've gained weight, but it's mostly in your stomach area, in this central region of your body. This is a sign of type 2 diabetes. The American Diabetes Association recommends that you test everyone after 45 years of age, because an increase in age actually does predispose you to developing this. Also, if you have prediabetes, if you have a history of gestational diabetes, or if you're certain ethnic groups such as African Americans, Native Americans, and Alaskans, and even Pacific Islanders, they're at an increased risk for developing type 2 diabetes. So what can you do to prevent type 2 diabetes or control your type 2 diabetes better? First secret lies in your diet. It's so important to eat a diet that is rich with fruits and vegetables and whole grains. This includes whole wheat bread and not as much of the white bread or the sweets. You gotta be really careful of sugar, specifically soda. Soda has a lot of sugar in it and fruit juice, so just pay attention. And an easy way to do this is when you go to buy something, before you buy it, Look at the back, look at the ingredients, and look at the nutrition label, and you'll see how much sugar is in whatever you're about to drink or eat. It's kind of an eye-opener when you really stop and take a look at these things. It's also recommended that you eat small meals rather than large meals. Even 6 meals a day, 6 small meals a day, if you can be disciplined with that, is going to be really helpful for your metabolism, for your body to handle that sugar level in your blood, and will help you control your diabetes and prevent diabetes in the future. It's important to reduce your fat intake also. Be aware of how much saturated fat you're eating and how much cholesterol you're putting in your body. It's also important to lower your salt intake. This will help reduce your blood pressure, which seems to go up when you have a lot of the signs and symptoms of type 2 diabetes. It's also advised to keep alcohol intake low. You should never drink in excess. The sugars that are in alcohol will also predispose you to type 2 diabetes. Protein is really important also. Protein is going to be your best friend. And common foods with protein in them, and that you wouldn't think of other than just lean meat like chicken, or even red meat that's really lean occasionally. Fish is really good, but also nuts and cottage cheese. Who knew cottage cheese has a lot of protein in it, as well as eggs, specifically egg whites, are really good for you. Exercise is another important key to controlling and preventing type 2 diabetes. Even without weight loss, exercise will significantly improve your glycemic control. In other words, it will help you control your blood sugar better. And what it does is it actually increases the insulin sensitivity. So remember, that's the problem with type 2 diabetes. So anything you can do to improve that sensitivity is going to be really helpful. The recommendation is actually 150 minutes a week of just mild to moderate exercise. This could be just walking briskly. So 150 minutes over at least 3 days. So if you wanted to, you could divide that into 5 days. That's just 30 minutes a day of walking. That's very doable, very easy goal to reach. And you know, if you can't reach 30 minutes, just start with 10 and build yourself up. Take baby steps and build yourself up from 10 to 15 to 20, and before you know it, you'll be at 30 minutes a day, 5 days a week. It's also recommended, and the studies have proven, that resistance training, in other words weightlifting, will help you control your diabetes as well as prevent it. They recommend this is done at least twice a week. Make sure with exercise that you warm up properly and you cool down properly. I would at least do 5 minutes of each. 5 minutes of warm up, 5 minutes of cool down. This will help prevent any injury and help you from being so sore, especially when you're first starting that exercise program. And I recommend that you choose activities that you like. If you like gardening, go out and garden. If you like walking, go walk. If you like swimming, go swim. Just choose activities that you enjoy so that you can look forward to it every day. You will be more likely to succeed with your exercise program if you do this. So is there anything else you can do to control your type 2 diabetes if you already have it? Yes, there is. First, you need to make sure you control that blood pressure. Again, over 130 over 80 is a good recommendation. Second, you need to control your cholesterol levels in your body. This means more fruits and vegetables, more whole grains, and decrease the amount of fat that you take in every day. Also, an aspirin a day is recommended. Again, this helps keep your heart healthy and your colon. It helps prevent against colon cancer. Insulin shots may be needed if you've gotten to the point where your type 2 diabetes has been out of control for a long time. Insulin might be needed at that point. But it's important to go talk to your doctor or your PA to determine when this is needed and how to start it appropriately. The last thing I'd like to discuss today is the complications that can come with type 2 diabetes. And there are many complications, and they can be very serious. I think it's very important to know these, especially if you're right on the brink of becoming diabetic or if you are diabetic. They are as follows. Cardiovascular complications. Being type 2 diabetic increases your risk of coronary artery disease, chest pain, and eventual heart attack stroke, and atherosclerosis, which that just means a hardening of the arteries or a narrowing of the arteries. The next complication will affect your nerves. Nerves do not respond very well to the high levels of sugar in your blood and can cause damage. Too high of blood sugar damages the smallest vessels in your body first. These vessels actually supply the nerves with the nutrients and the oxygen that they need. So if you're damaging the vessels, you're going to damage the nerves. And for some reason, the lower legs, specifically the feet and lower legs, are affected most commonly and first. Eventually, you'll feel tingling, numbness in your toes and in your lower legs and feet. And it can progress to where you can't feel your feet at all. Nerve damage can also cause nausea, vomiting, diarrhea, constipation, and impotence in men. Your kidneys can become affected by these high levels of blood sugar. The reason for this is your kidneys, the main function of the kidney is to filter all the waste products out of your blood and out of your body. So these high blood sugar levels can actually damage this filtering system of your kidney. Damage to the kidneys can actually progress and cause the kidneys to completely fail. You can imagine if your kidney cannot filter out all the toxins that it needs to and the waste products from your body, you're going to build up all these toxins and eventually have kidney failure. Remember, kidney damage is irreversible. There's no way you can get it to return or make the kidney healthy again once you've damaged it. The eyes can be affected by these high levels of blood sugar. That's because, again, the high levels of sugar in the blood can cause damage to the small vessels in the eye, specifically the retina. This can lead to damage to the retina, which again is irreversible, and can lead to blindness. Diabetic retinopathy is the leading cause of blindness in the U.S. The feet can be affected by these high levels of sugar in the blood. This is because, again, the nerves, which we already talked about, become damaged because the blood vessels become damaged. And so what will happen is a cut will happen on the toe or on the foot, and you can't feel it, and the body has poor circulation down there, so eventually that cut cannot heal like it should. And because of that, infection happens, and again, the body cannot heal the infection, tissue begins to die, and can even lead to amputation. You know, I'm out of rotation right now, and I've spent time with the podiatrist there, and you would be amazed at how many people come in that have diabetes that have had to lose a toe or lose a couple of toes because they have had small cuts or blisters on their feet that have turned infectious and caused osteomyelitis of the bones of the feet. So again, diabetes can be really bad and hard on the feet. Skin and mouth infections are common with diabetes. This is because the immune system becomes infected. So the skin specifically and mucous membranes are not able to fight off the bacteria and fungus that it normally can, which predisposes your body to having these infections. Again, yeast, fungal, bacteria infections become very common in the skin and in the mouth with diabetes. That concludes our talk on type 2 diabetes today. I hope you found it to be helpful and informational. Again, if you feel like you may have symptoms, signs and symptoms of type 2 diabetes, or if you have any further questions, please don't hesitate to contact your doctor or your PA. They will be able to help you out further in determining if you do have type 2 diabetes. They will also be able to get you on the correct medications if you need and get you any extra help that you need to.